All right, this is the second MCQ of the day, and let's dive in. Let's understand this MCQ, and with the help of this MCQ, we will cover one topic. A 28-year-old woman, G2P2, Gravida 2, Para 2, comes to the emergency department 10 days after delivering her second child. The husband report that she has been agitated, hearing voices telling her to harm the baby, and this is something which I should highlight, hearing voices, because if she is hearing voices, it indicates that it is auditory hallucinations. Okay, so we have one unique thing, that after childbirth she has auditory hallucinations and not slept for 3 days. This is another point. Rapid mood swings, and she's alternating between fear, inappropriate laughter. There is no history of substance abuse. This is a good negative history. Maternal aunt has bipolar disorder. I don't think that matters much. And so he has asked about the management of this patient. So we'll see all the options one by one. Will decide. Okay, what is the right answer? First is to reassure her and monitor her at home. No, reassurance will not work. She might probably end up hurting the baby. Then is you give SSRI. You can give SSRI if she is having just depression, but she is not having just depression. She is also having hallucinations, which indicates that she is in psychosis. Now the third option is that in start an antipsychotic medication and hospitalization. This seems to be the right answer. We'll still cover the other options. Administer benzodiazepine for sedation. That's probably what a quack might do in some rural setup, or this seems to be a very possible practical thing that a quack might do, but it's not the right answer. And recommend CBT. CBT is not going to be enough. Now, what is the funda behind this MCQ? The funda behind this MCQ is that you need to know three things. The three things are postpartum blues, postpartum depression, and postpartum psychosis, PPP. Okay, PPP is for postpartum psychosis. See, postpartum blues is a feeling in the mother that she is not feeling good, like she'll cry for no reason, she'll not be able to sleep, she'll have little bit of insomnia, mood swings, a general feeling of discomfort, a general feeling of not well-being, and it goes away on its own with reassurance and with family support. But the thing that you as a medical student, especially as an exam giver, what you need to know is postpartum blues happen in the first 2 weeks. That is, they happen in the first 2 weeks after delivery. If she is having similar symptoms after 2 weeks, which the depressive symptoms are lasting longer than 2 weeks, more than 2 weeks, 2 weeks to a few weeks, then you are going to have to suspect postpartum depression. And postpartum depression is going to be not just that I am not feeling good. She might have suicidal ideation also. She might be insomniac, or she might have unnecessary anxieties. So all these clues are going to be there. At that point, you in the exam have to select the answer as SSRI, and you start SSRI here. You reassurance is not going to help over here. And in postpartum psychosis can happen anytime. In the question it's given in the 10 days, but it can happen anytime till maybe a couple of weeks. Okay, so the important thing about psychosis, it has to have some psychotic features, like Features of psychosis are hallucinations. She has the thoughts of hurting the baby, hurting herself, and another important thing is she is showing bizarre behaviors. Sometimes this can be the presenting feature. So in case of postpartum psychosis, you SSRIs won't be working. Okay, and you need to give her antipsychotic. Give her antipsychotic, and as well as hospitalization, and separate the baby and the mother. Put her in hospital, keep her separate from the baby, because in unsupervised when she is unsupervised, she can even hurt the baby because she is in psychosis. uh, One point I forgot to tell you is that the SSRI you give in postpartum depression is generally sertraline, because sertraline is generally considered safer for the baby. Does not go in the breast milk, that's what we say. So with the help of one MCQ, we have covered one topic in a quick way. So keep listening to this series of mine. I have started a new initiative that I'll try to discuss this kind of MCQs, random MCQs, almost every day. And thank you.